You didn't give up today. That matters.
In this short video, you'll learn what chest X-ray findings you can see in reactivated LTBI and why they happen. A 22-year-old man moved from India to the United States. 7 months later, he developed pulmonary tuberculosis. Because no one around him had active TB, doctors suspected reactivation of LTBI. Now, which chest X-ray matches reactivation TB? Right upper lobe cavitary infiltrates. Fibrosis with calcified nodules. Lower lobe infiltrate with hilar lymphadenopathy. The answer is A. Reactivation TB loves the upper lobes because the oxygen level is highest there. Mycobacterium tuberculosis is an obligate aerobe, so it grows best in high oxygen environments. As the bacteria multiply, they destroy lung tissue, forming cavities, classic for reactivation disease. These are signs of old TB. Fibrosis and calcification happen when the immune system successfully walls off the bacteria. This represents LTBI or healed TB, not active disease. There is no cavity because the infection is controlled. Primary TB usually affects the mid or lower lung zones and causes hilar lymph node enlargement. Tuberculosis is an obligate aerobe, so why doesn't primary TB start in the oxygen-rich upper lobes? The answer is surprisingly simple. When you inhale TB droplets, airflow and gravity make them settle in the middle and lower lung zones. Macrophages swallow the bacteria, but can't kill them completely. Instead, they carry TB straight to the hilar lymph nodes. That's why primary TB shows a small lesion in the mid, lower lung plus hilar lymphadenopathy. In contrast, during LTBI, TB bacteria lie dormant inside a granuloma. When immunity drops, they wake up, and now they move to their favorite place, the oxygen-rich upper lobes, where they can grow again. This is why reactivation TB typically gives upper lobe cavitary disease. So the key difference is this: primary TB depends on where the bacteria first land, while reactivation TB depends on where they can grow best once they escape the granuloma. Now for the final question. What are the Ghon focus and Ghon complex, which are commonly seen on chest X-rays after a primary TB infection? A Ghon focus is the initial infection site where macrophages, epithelioid cells, and Langerhans giant cells gather, while lymphocytes form an outer layer that walls off the TB and traps it inside. A Ghon complex is this Ghon focus plus the enlarged hilar lymph node where macrophages carrying TB accumulate. Thank you for watching until the end. In the next video, I'll explain who is considered a close contact of a TB patient and needs to be evaluated.
For quick, powerful reviews, this is the only channel. Don't forget to subscribe.